This is Insider Medicine in 60 from Minnesota. The higher degree of obesity a person has, the more likely they are to suffer a stroke, regardless of how the obesity is measured, according to a report published in Stroke, Journal of the American Heart Association. Researchers studied over 13,000 adults for 19 years, finding that patients in the highest BMI category had up to 2.12 times increased risk of stroke. Those with the highest waist circumference had an increased risk of up to 3.19 times, and those with the highest waist-to-hip ratio saw their risk increase by up to 2.55 times. From Michigan, according to a report published in the journal Catheterization and Cardiovascular Interventions, giving chest pain patients an electrocardiogram before going to the hospital has significant benefits. Researchers studied two groups of patients with symptoms suggestive of a heart attack. One received an ECG in the field, and the data was sent electronically to the hospital so that ER physicians could interpret the data and prepare for the patient's arrival, while the control group had no pre-hospital ECG. Results showed that the ECG group had a lower mortality rate and a shorter time to treatment than the control group. And finally, from Orlando, according to a report presented at the ASCO's GI Cancer Symposium, researchers may have developed a blood test that can detect early colorectal cancer. Testing for CD24 protein levels in one group of patients with colorectal cancer and in another group of healthy controls, researchers saw that the test had a 78% sensitivity and nearly 87% specificity at distinguishing between the two groups. For Insider Medicine in 60, I'm Dr. Susan Sharma.